Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS. In 2019, after a 2-year rebranding process, and after 32 years of service to the African American community, the National Black Leadership Commission on AIDS became known as the National Black Leadership Commission on Health. A new mission: to champion promotion of health and prevention of diseases, to reduce disparities and achieve equity within the Black community. And a new vision: to promote the health and wellness of Black communities through education, advocacy, and policy. I certainly will say that this was a major development, an organization evolution, quite frankly, that expanded its health-focused areas to address multiple health issues and disparities that disproportionately affect African Americans, including HIV, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health. We know all of these diseases disproportionately impact African Americans at levels, different levels in comparison to other racial ethnic groups. And we know the intersectionality between HIV and these other health diseases. So again, this was a major organizational move, but it was timely. And we also wanted the name to more accurately reflect the work that we do. And today we have a very important discussion on one of our areas, and it will probably go into other discussions, but today we're going to focus on HIV and pre-exposure prophylaxis, known as PrEP. And I'm pleased to be joined today virtually by Leisha Mckinley-Beach, a nationally renowned, recognized HIV/AIDS educator and consultant based in Atlanta, but known for her leadership, education, and advocacy work. Now, I've known Leisha for a number of years, and I tell you, she has a story. And the way I'd like to begin today is for Leisha to talk with us about what you do and what made you come into this field for the number of years that you've been in it, leading, directing, educating. And I can't think of a person I would rather be having this conversation with as it relates to HIV/AIDS, its impact among Black women. And as we look at PrEP and how that is or is not affected, or the uptake or lack thereof among Black women, and what we might have to do in order to create some lasting impact. We both know that a lot has happened since we became aware of what it is, and lots of things have taken place, but we're still seeing Black women have higher rates than any other group as it relates to the gender lens, through the gender lens. And we're going to talk about that. But first, I want you to tell us a little about yourself, what you do, why you do it, and what has made you stay in this field for these number of years. Welcome, Leisha.
Thank you so much, Ms. Fields. Can I just first say, one, it is an honor to be having this conversation with you as what may indeed be one of my final HIV interviews. And two, as usual, I am so starstruck by you. I wish you could see under this desk I'm sitting at, my knees are just knocking. Like, I can't believe it's a one-on-one with Miss Virginia Fields. So indeed, what an honor. It seems full circle for me just in this moment right now, as you talked about the first 32 years of this work with your organization being focused on HIV. And we are now talking about my transition out of HIV after 32 years of service. That number is symbolic for something. So I'm gonna let the elder, give us any revelation for that. But I will say what kept me for 32 years was the love and the compassion for the community that we both serve. We've been some privileged women to be seated around tables, some tables that didn't want us, some tables that didn't invite us. We invited ourselves because it was necessary for the community that we served. And when we got there, what we discovered was that our voice was needed in the space. Our voice for Black women, our voice for Black communities, our voice for Black men, our voice for Black people of trans experience, and everyone who falls in between the spectrum. That's what kept me there. And now I'm in a season of life, Ms. Fields, where I want to shift and contribute in a different way. That there are some amazing young leaders that have an opportunity to help advance us from good to great. And I want to relinquish my space to give them a chance to shine and to show the brilliance that they bring. But I also want to play a role in the background and to help to continue to mentor and coach, specifically with state and county health departments. And so I created the Black Public Health Academy this year as a part of my transition to be able to do just that, to help staff. If you ever worked in a county or state health department, or if you ever had a relationship with somebody who worked in a state or county health department, you already know that if it had not been for faith on their side, they wouldn't be there. It is such a struggle to be able to serve our people in an institution and an infrastructure that was not designed for Black people to be healthy. And so how do you survive in that? And so the years of experience, and I got the battle scars, Miss Fields, to prove I done been there and done that. I don't even wear the t-shirt. The t-shirt brings back too much trauma for me. But I've decided to turn that trauma into triumph and to help these new leaders who want to advance to decision-making positions in health departments be able to do so. So that's where I'm going. That's where I'm going, Virginia.
Well, and I want to make note of this. I know you were one among several women who were honored at the recent United States AIDS conference back in September, and you were a champion of changes, as they were called. And in there, it tells your full story. And I was intrigued by one of the comments I think your husband had made about your commitment to this work, and that it is so much a part of who you are and what you've done. It's like almost saying he may have had difficulty separating the two. This is Leisha, this is AIDS. It's all in one. And of course, he talked very, highly favorable in terms of the work that you've been doing. But this was a great honor to be a part of the Champions of Change. And of course, it tells her story as a nurturer, someone who has done a lot of what she talked about that she looks to continue to do. So I congratulate you on that. That was an honor. And I know that as you close this door, many more doors and windows are opening up. And I know we're going to be hearing from you for a longer period of time. So thank you for at least sharing that. So you want to talk a little about, again, as we've said, despite the advances that have been made in addressing HIV, antiretroviral treatment, a lot of the research that has been done, and we have basically eliminated the transmission of HIV from mother to child. And we've seen these advances and been in those rooms, as you said, where the discussions have taken place. But the reality is, Black women still account for a higher proportion of new HIV diagnoses and people living with HIV compared to any other race and ethnicity. And we know that PrEP is one of the newer interventions or tools, so to speak, that we talk about that's available, but we still see Black women not being included. So what can you tell us as number one, why are we continuing to see this high rise in numbers among Black women?
So Ms. Fields, let me slow it down.
Please call me Virginia, because when you call me Miss Fields, I'm saying, who is she talking to, Leisha?
Now, I got about 20 minutes left in HIV. You gonna ask me to revert to this 5-minute privilege in 32 years I've called you something else. So I'm gonna try Virginia, but you're gonna have to give me some grace. You're gonna have to give me some grace. I want to slow it down a little bit. And I just want to repeat something that you said, because I don't want people to lose sight of what we have in this moment in terms of ending HIV for Black women. We now know that Black women who achieve what we frame as viral suppression, meaning that there's so few copies of HIV in their system, they are no longer passing or transmitting the virus onto their sexual partners. The other end of that spectrum is we now have this biomedical prevention that we know is PrEP, pre-exposure prophylaxis. So a medication or a treatment that people can take before they come into contact with this virus and prevent transmission from occurring. So that's huge. When you think about it, on the one end, if people who are diagnosed with HIV and treatment and care achieve viral suppression, they're not transmitting it. And on the other end, you're talking about people who have are on PrEP and they're not getting it. We're talking about an end. We're talking about an end to HIV. But why are we not talking about the end for HIV with Black women in the same way we're talking about an end to HIV with other populations, such as white men? Because when you look at the data that is presented before us, it shows us a couple of things. Number one, Black women are not achieving viral suppression at the same rate that other populations are. Number two, when we look at this medical advancement with PrEP, we see that for white men, 94% of white men who can benefit from PrEP, they already on it. When we look at Black women, about 11% of Black women who can benefit from PrEP, they're on it. Some data show as low as 8%. So you think about that for a moment. White men, practically every white man that could benefit from PrEP, they got a prescription and they are taking it. But Black women, not even 15, 14% of us that can benefit are on it. And so then you start to ask this question. So whose end are we working for? Right? Because when I see this spectrum of access, and when I see this spectrum of awareness and tools to promote and encourage and motivate white men, I don't see that same effort for Black women. And so can we end HIV by 2030? And the answer is yes and no. Yes, I do believe in the next 7 years, we could potentially be talking about an end for white men. But for Black women, far from it.
That's a very scary notion, right? And again, what's so exciting about this conversation with you is because you've been in it for 30 years. You have seen it. You have been at the tables. You've helped put reports together and pushed for research and fought for services in our community on the prevention level, on the treatment and the care level, and to still see less than, or I think you mentioned, only about 11% of Black women who are eligible for PrEP are actually taking PrEP. How does this relate to also being offered the medication, or when women go to their medical providers, are they even talking to Black women about this, or are they still making the same kind of decisions? Oh, you don't look like you should be a person to have this conversation, being very judgmental because they don't know people's sex life, and don't know who they are sleeping with one way or the other. So why are we not seeing medical providers step up and have these conversations? Is that still pretty much in the dark ages?
Yeah, that's a great question. And the reason that we're not seeing medical providers step up is because of their own bias. For what you just said, that there are some assumptions about who look like they could benefit from PrEP or not. And so for Black women, we have to go in already educated, already knowledgeable, and already committed to walk out the door with a PrEP prescription in order to gain access to PrEP. And that's not the same scenario for all populations. In terms of awareness, if we're going to get Black women to that place where they know that PrEP is for them, we're going to have to step up the awareness around PrEP and that Black women can benefit from it. Far, far too often, I hear of stories from my colleagues and the stories that I've heard personally of Black women not even knowing that PrEP is also for women, that they have watched this one commercial on television that talks about this particular medication is not for those assigned female at birth. So that medication may not work for women, but that doesn't mean that PrEP doesn't. So here we are again, that the champions to correct the wrong, they look like you and they look like me. And then it becomes overtime. It becomes overtime work and making sure that women in our community are aware that yes, you too can benefit from PrEP, and that yes, you too, if your doctor does not offer it to you, that you have the right to ask for it.
And I know that both of us worked on a recent, a report that was recently released from Georgetown University that called for certain actions to be taken, including research and looking at or developing new models of programs that address Black women, and not assuming that one size fits all in the programs that are out there are just used now for women. So there are two things I'm going to ask you to do. I'm going to ask you to talk about that briefly. Then we have about 5 minutes left in this. And because this is probably, as you said, your last major interview before you step on another stage out of retirement here, but continuing your long life journey in other areas related to this, I am going to give you a platform to just share whatever you think we need to know about this, what we can do, and your instructions for those younger people who are coming behind us, what they must do. So for the next 5 minutes, it is yours.
Thank you so much, Virginia. It don't even sound right. Miss Fields, thank you. Thank you so much. I would say that what an honor it was to sit with you and other major Black women leaders in this country and create this issue brief with the O'Neill Institute at Georgetown University. I said it then and I believe it now, that this brief really can become the launch for something amazing for Black women in the HIV space. There is some advocacy, though, that must take place. Some of that advocacy starts with the highest offices in this country, such as the National Institutes of Health, asking NIH to fund research where the principal investigators are Black women. Who would know better about the needs of Black women than those who are living the experience every day, who just so happen to be researchers? That becomes a critical part of this journey as it relates to PrEP. In terms of PrEP, making sure that we go beyond just talking about why Black women are not benefiting from it, but we take action and we hold pharmaceutical companies accountable for their role in ensuring awareness and ensuring access to the medication. It also becomes our responsibility as advocates to hold the medical community accountable, making sure that when a woman walks into an office, that she is provided the same information, has the access to the same assessment, so she can walk out with the same medication as her male counterparts. These are all critical steps in terms of getting to know new diagnoses among Black women. If I had to leave the HIV space with a charge, that charge would be, we do not let the end of the epidemic come to fruition for one community while the other communities still struggle and suffer. See, my greatest fear has been that when white men declare victory over HIV, that the attention dries up, that the funding dries up, the awareness and the focus in the healthcare arena dries up, then what happens to Black women? We are already known as a community that will fight for ourselves. But there are some allies that need to watch this very interview with you to say, what do I do while I'm at the table, while I got a seat? How do I show up as an ally so that when we talk about declaring the end of HIV in the United States, it's because we're able to declare the end of HIV in Black communities.
I mean, those are powerful words, and I am just so happy that you agreed to be on this show in order to kind of take us to the next level as you move to another area in your life. And I certainly want to thank you and to for joining me today. And I think the words, your comments have certainly been an inspiration to our viewers, and I know that a lot has been learned. We also know about the inequities that are that's shown in the data that reveals racial, gender, socioeconomic, and heteronormative biases. And only by lifting our voices collectively to speak about this and to continue the advocacy work that you've done for so many years is going to allow us to make the difference. So I want to thank you, and I certainly do wish you the very best in your retirement. And I know it's going to be very enjoyable because I can see the look on your face, and you are so ready and you are so happy. But I know we will see you again. And so I want to thank our viewers and the Manhattan Neighborhood Network that brings us these programs to better inform our viewers about the important topics that we have addressed today. And I am C. Virginia Fields, and I thank you for joining us. And to say you can contact me at the National Black Leadership Commission on Health, email info@nblch.org, or go to our website, www.nationalblackhealth.org. This has been tremendous. And again, all the best to Leisha Mckinley-Beach as she goes on her retirement, and for joining me today. Thank you.